Hi everyone, my name is Cyril Asonganyi, a master's student from Grand Canyon University, completing my master's program in mental health and wellness as part of the compliance to award the master's degree or the graduate degree program, the graduate degree to us. It is part of the requirement for us to complete a presentation, and I will be presenting on post-disaster trauma. I would like to define what trauma is all about before we proceed. Trauma is actually um, a response to a terrible event that occurred. It could be an accident, it could be a rape case, it could be a disaster, a natural disaster that occurred. Um, also, looking at what trauma is all about. At the end of every event, when it concerns trauma, we end up looking at it from a perspective of post-traumatic stress disorder. Post-traumatic stress disorder, which is sustained from after when somebody undergo a traumatic situation, something that disturbs the mind, something that bothers your mind, something that any moment you kind of want to feel happy and you kind of realize that you are thinking about something you underwent, a traumatic event, an abuse, an assault, a combative situation that made you to be very unhappy. We also look into the different interventions that could help people out there who are suffering from victims out there who are suffering from trauma. We look at the integrated treatment trauma integrated treatment complex for trauma patients, for trauma people. We look at the trauma system therapy for refugees. We look at the trauma focused cognition behavioral therapy for people. For this varies in age. This varies between the age of 3 to 18 years. We are also looking at the unproductive counterproductive interventions, which this talks about. These are the interventions that are thought to be hazardous, ineffective, or both. However, they might offer a momentary reprieve from suffering. The interventions include overgeneralization, rumination, processing, and avoidance of behaviors, emotional blunting. These are all part of situations that can make you to have such situation. Overgeneralization, ruminative processing, like thinking about the trauma repetitively. There are also resources out there for people suffering from trauma victims, like the NAMI, the National Alliance for Mental Illness. You also have the National Center for Post-Traumatic Stress Disorder. You also have the National Domestic Violence Hotline. You also have the Substance Abuse and Mental Services Administration. You also have the Legal Aid Society, like those who have undergone domestic violence or sex trafficking. You also need to attend conferences and listen to social medias, some talks of people who have been able to undergo situations like that. There are so many mentors out there as well that can help people who are undergoing trauma, that they can share their own experiences to you and you get to understand. There are professionals out there like ourselves who could be able to advise you one or two things that can help you actually overcome your situation when you're undergoing trauma. These are some references of some sites that we looked up information to be able to build up this data. Thank you so much and do have a wonderful rest of your day.